Every year, more than 1 million Americans are hospitalized for heart failure. And here's what terrifies me most as a doctor. Most of them saw warning signs for months, sometimes years before they ended up in the emergency room. They felt exhausted. They couldn't climb stairs without getting winded. Their feet were swollen. They had a persistent cough, but they didn't recognize these as heart failure. They didn't think they were serious. They dismissed them as normal aging. And then one day their heart could no longer compensate. They couldn't breathe. They collapsed. They ended up in the ICU, and some of them never left the hospital. Heart failure kills more seniors than all cancers combined. It's the leading cause of hospitalization in people over 65, and it's almost entirely preventable if you catch the warning signs early. The problem is that the early warning signs are subtle, they're silent, they're easy to miss, they're easy to blame on other things. You feel tired? Must be getting old. You're short of breath? Must be out of shape. Your feet are swollen? Must be circulation problems. Your mind feels foggy? Must be normal cognitive aging. You have a dry cough? Must be allergies. But they're not. They're your heart desperately signaling that it's failing. And if you recognize these 6 warning signs today, if you understand what they mean, you could literally save your life or the life of someone you love. I'm Dr. William, and today I'm revealing the 6 silent warning signs of heart failure that almost nobody recognizes. Stay with me until the end, because warning sign number 4 is the one that absolutely nobody connects to heart failure, yet it's often the earliest indicator that your heart is in trouble. Before we get to the warning signs, you need to understand what heart failure actually is. Most people confuse it with a heart attack. They're completely different. A heart attack happens suddenly, a blood clot blocks an artery, part of the heart muscle dies, you have severe chest pain and a medical emergency. Heart failure is different. Heart failure means your heart muscle is weak or stiff, and it can't pump blood effectively to your body. It's not sudden. It develops gradually, often over months or years. Your heart is still beating. You're not having a heart attack, but your heart isn't doing its job efficiently. And because it's not pumping blood forward effectively, blood backs up into your lungs, your legs, your abdomen, fluid accumulates, your organs don't get enough oxygen-rich blood, your body compensates for a while, but eventually compensation fails, and you're in crisis. Here's what's critical. Heart failure caught early is highly manageable. You can live a good quality of life for years or decades with heart failure if it's diagnosed and treated properly. But heart failure caught late, after months or years of symptoms you've ignored, that's when you end up hospitalized. That's when complications develop. That's when your life is turned upside down. The difference between early and late diagnosis is often just recognizing the warning signs. And that's what we're going to focus on today. I'm Dr. William. I've spent over 2 decades working with cardiac patients, particularly seniors with heart failure. I've seen the trajectory. Early recognition leading to excellent outcomes, and delayed recognition leading to crisis. I've worked with cardiologists, watched countless echocardiograms, reviewed thousands of patient charts. And the pattern is always the same. The patients who do best are the ones who recognize warning signs early and sought help immediately. The ones who suffer the most are the ones who ignored or dismissed the warning signs, assuming they were just part of aging. I'm sharing this knowledge with you not to frighten you, but to empower you, to give you the information that could prompt early diagnosis and change the trajectory of your health. Let's start with the first warning sign, and it's one that's almost universally dismissed as just getting older. Persistent, unusual fatigue. Now, yes, we all get tired. Yes, aging brings natural energy decline. But there's a specific type of fatigue that signals heart failure, and it's different from normal aging. When your heart is failing to pump blood effectively, your muscles and organs aren't getting enough oxygen. Your body has to work harder to function. Everything becomes exhausting. You sleep 9, 10, 11 hours and still wake up feeling like you haven't slept. Activities that used to be easy, walking, climbing stairs, grocery shopping, leave you completely exhausted. And this fatigue comes on over weeks or months, getting progressively worse. Why is this missed? Because people attribute it to depression, to aging, to not exercising enough, to poor sleep. They don't think, my heart. I had a patient, Susan, 68 years old. Over the course of 3 months, she became progressively more exhausted. She slept longer and longer, but never felt rested. Her family suggested she was depressed. Her doctor prescribed antidepressants, but the fatigue kept worsening. When she finally came to see me, I ordered an echocardiogram. Her ejection fraction, the percentage of blood the heart pumps with each beat, was only 25%. Normal is 50 to 70%. She had severe heart failure. Once we started appropriate heart failure medications, her energy returned. Within weeks, she felt like herself again. She realized the fatigue hadn't been depression, it had been her heart screaming for help. So what should you do if you're experiencing persistent, unusual fatigue? Mention it to your doctor. Be specific. I'm more tired than usual. It's getting worse and I'm sleeping more but not feeling rested. Don't just say, I'm tired. Request an echocardiogram and blood work. Your doctor might not think to check your heart for fatigue unless you specifically raise it as a concern. But the next warning sign is even more dangerous, and it's also constantly missed. This is the warning sign that should absolutely trigger a call to your doctor. Shortness of breath, particularly new shortness of breath or worsening shortness of breath, is one of the most common symptoms of heart failure. Here's why it happens. When your heart fails to pump blood forward effectively, blood backs up into your lungs, fluid accumulates in the air sacs, your lungs become congested, breathing becomes difficult, you feel like you can't get enough air. Now there are many causes of shortness of breath: asthma, pneumonia, obesity, deconditioning, but heart failure shortness of breath has specific characteristics that should alert you. First, shortness of breath at rest. You're sitting quietly and you suddenly feel like you can't catch your breath. That's not normal. That's not asthma. That's not being out of shape. That's your heart failing. Second, shortness of breath with minimal exertion. You walk from your bedroom to your kitchen and you're breathing hard. You climb one flight of stairs and you're gasping. That's not normal aging. That's a red flag. Third, waking up at night gasping for breath. This is called paroxysmal nocturnal dyspnea. You're sleeping and suddenly you wake up feeling like you're drowning, like you can't breathe, like you're in panic mode. You have to sit up to breathe. This is one of the most specific symptoms of heart failure, and if you experience it even once, you should call your doctor immediately. Why is this missed? Because people think, I must be getting old, or I must be out of shape, or I must have asthma. They don't think my heart is failing. But shortness of breath is your body's emergency signal. I had a patient, Robert, 72 years old. He couldn't walk up the stairs in his house without stopping halfway and gasping for breath. His wife suggested he join a gym and get in better shape. His primary care doctor said, "You're just getting older, that's normal." But Robert knew something was wrong. He insisted on seeing a cardiologist. His ejection fraction was 20%. He had severe heart failure. Once he started heart failure medications, he could climb stairs easily. He joined a hiking club. The shortness of breath that everyone had attributed to aging and deconditioning was actually his heart failing. So if you experience new or worsening shortness of breath, especially if it occurs at rest with minimal exertion, or if you wake up gasping at night, call your doctor immediately. Don't wait for an appointment. Don't assume it's asthma. This is serious. But the next warning sign often appears years before shortness of breath develops, and almost nobody recognizes it. When your heart fails to pump blood forward efficiently, blood backs up into your veins. Pressure in those veins increases. Fluid leaks out of the veins into the surrounding tissues. You get swelling. This swelling typically appears in the legs and ankles first because gravity pulls fluid downward, but it can also appear in the abdomen and the hands, even in the face. Now, there are many causes of leg swelling: poor circulation, sitting too long, lymphatic problems, kidney disease, liver disease, but heart failure swelling has specific characteristics. First, it's pitting. If you press on the swollen area with your finger, an indent appears and takes several seconds to fill back in. That's pitting edema. That's different from swelling from other causes. Second, it worsens throughout the day. Your feet are normal in the morning, but by evening your ankles are puffy. Third, your shoes get tighter as the day progresses. Your rings get tight. Your watch gets tight. Fourth, it's symmetric. Both legs swell. Both ankles swell, not just one side. Why is this missed? People think, I have poor circulation, or I'm retaining water, or my kidneys aren't working well, or I'm just getting old and my legs are swelling. They don't think my heart is failing. But swelling means your heart is already significantly struggling. The fluid backing up into your legs means your heart can't pump blood forward effectively. I had a patient, Margaret, 75 years old. Her feet and ankles were so swollen she could barely wear shoes. She'd seen her primary care doctor multiple times about the swelling. He'd done some basic tests, ruled out obvious causes, and basically said, "Welcome to old age." But Margaret's daughter insisted on a cardiology referral. Echocardiogram revealed severe heart failure. Once she started diuretics and heart failure medications, the swelling resolved completely. She was back in regular shoes within weeks. The swelling that had been attributed to aging and circulation problems was actually heart failure. So if you develop new or worsening swelling in your legs, ankles, or abdomen, especially if it's pitting, if it worsens throughout the day, if shoes and rings get tighter, mention it to your doctor. Request a cardiology evaluation. Don't just accept it as normal aging. But the next warning sign is something almost every senior experiences, and almost nobody connects it to their heart. This is the warning sign that absolutely breaks my heart because it's so commonly missed. When your heart fails to pump blood effectively, your brain doesn't receive enough oxygen-rich blood. The brain is incredibly sensitive to oxygen deprivation. Even a small reduction in blood flow to the brain can cause cognitive problems. You experience confusion, memory loss, difficulty concentrating, brain fog. Your thinking slows down. You struggle to follow conversations. You forget things you usually remember easily. Why is this so completely missed? Because people and doctors attribute it to normal aging, to early dementia, to Alzheimer's disease. An elderly person starts having memory problems, getting confused. What does everyone think? Oh, they're developing dementia. And they do a cognitive workup, a neuropsychological evaluation, maybe even start them on dementia medications. But nobody checks their heart. Nobody does an echocardiogram. The cognitive decline is heart failure, not Alzheimer's. And here's what's crucial. This is completely reversible. When you treat the heart failure and restore adequate blood flow to the brain, the cognitive function returns. The dementia was actually insufficient brain perfusion. I had a patient, James, 79 years old. His family brought him to his primary care doctor because he was becoming forgetful and confused. His wife was worried he was developing Alzheimer's. His doctor agreed it sounded like early cognitive decline and referred him to neurology. But before the neurology appointment, I happened to see James for an unrelated issue and asked about his overall health. He mentioned he'd been feeling tired and short of breath lately. I ordered an echocardiogram. His ejection fraction was 22%. He had severe heart failure. Once we started appropriate heart failure medications, something remarkable happened. His memory improved, his confusion cleared, his thinking sharpened. His family was astonished. They'd been preparing for cognitive decline for potential Alzheimer's, and it turned out to be treatable heart failure. The dementia was actually his heart failing. This is why this warning sign is so critical. If you or a loved one is experiencing new confusion, memory loss, difficulty concentrating, or brain fog, especially if accompanied by any of the other symptoms we've discussed, please ask your doctor to check your heart. Get an echocardiogram. Don't just accept it as normal aging or early dementia. It could be your heart, and it could be completely reversible. But there's another warning sign that often appears alongside cognitive changes, and it's something most people dismiss. This warning sign is subtle but significant. If you've been able to do a certain level of activity, walk a certain distance, climb stairs, exercise at a certain intensity, and suddenly you can't, if activities that used to be easy now leave you exhausted, that's a warning sign. Here's the mechanism. When you exercise, your muscles need more oxygen. Your heart has to pump blood harder and faster to deliver that oxygen. If your heart is failing, it can't respond appropriately to the increased demand. Blood doesn't reach your muscles efficiently. Your muscles don't get the oxygen they need. You feel exhausted, weak, like your heart is racing. You have to stop. You can't continue. Why is this missed? People attribute it to deconditioning, to laziness, to normal aging decline. I'm just out of shape, they say. I don't exercise anymore, so of course I can't do what I used to do. But there's a difference between gradual deconditioning over years and sudden loss of exercise tolerance over weeks or months. If you could do something 6 months ago and now you can't, that's not just being out of shape. That's a warning sign. I had a patient, David, 70 years old. He was an avid golfer, played 18 holes, easily walked the course, never used a cart. Then over the course of 3 months, he found he couldn't play more than 9 holes without stopping to rest. By 6 months, he couldn't play 9 holes. He assumed he was just getting older, that his body was failing. He was devastated because golf was his life. When he came to see me, I recommended cardiology evaluation. His echocardiogram showed moderate heart failure. Once he started appropriate medications, his exercise tolerance improved dramatically. Within 2 months, he was back to playing 18 holes. The decreased exercise tolerance that he thought was inevitable aging was actually treatable heart failure. So if you notice a significant decrease in your exercise tolerance over a short period activities you could do easily a few months ago now exhaust you, that's worth mentioning to your doctor. That's a warning sign. But there's one final warning sign, and it's so subtle and so commonly overlooked that most people don't even mention it to their doctors. This is the warning sign that absolutely baffles patients and doctors alike. You have a dry cough, not a cough with mucus or phlegm, a dry, persistent cough that won't go away. You've had it for weeks or months. You try allergy medications, doesn't help. You try asthma inhalers, doesn't help. You try acid reflux treatments, doesn't help. Nothing helps. And you've probably seen your doctor multiple times about it. They've examined you, ordered chest x-rays, ruled out pneumonia, ruled out lung cancer, and basically shrugged and said, I don't know what's causing it. And the whole time, nobody has checked your heart. Here's why this happens. When your heart fails, blood backs up into your lungs. Fluid accumulates in the air sacs and the surrounding tissue. Your lungs become congested. This congestion triggers a reflex cough. Your body is trying to clear fluid from your lungs. But it's not mucus, it's fluid from heart failure, so cough medicines don't help. Antibiotics don't help. Inhalers don't help. Only treating the heart failure helps. Why is this completely missed? Because doctors and patients think dry cough means lungs. Asthma, allergies, acid reflux. Nobody thinks heart. But persistent dry cough, especially if it worsens when you lie down, when fluid in your lungs increases, is a classic heart failure symptom. I had a patient, Patricia, 73 years old. She had a persistent dry cough for 4 months. She'd seen her primary care doctor 3 times. He'd tried allergy medications, asthma medications, acid reflux medications, nothing worked. He'd even ordered a chest x-ray to rule out pneumonia and lung cancer. Everything was normal. He basically told her, I don't know what's causing it. You're probably just stuck with it. Patricia was frustrated and scared. Then one day she mentioned the cough to her daughter, who suggested it might be her heart. Patricia's daughter insisted on a cardiology referral. Echocardiogram revealed heart failure. Once Patricia started diuretics and heart failure medications, her cough disappeared completely. Within 2 weeks, she was cough-free. The persistent dry cough that had baffled multiple doctors and caused her months of suffering was actually her heart failing. So if you have a persistent dry cough, especially if it worsens when you lie down, especially if it's accompanied by any of the other symptoms we've discussed, mention it to your doctor and specifically ask them to check your heart. Don't just accept it as allergies or asthma or something you're stuck with. This is your heart sending a distress signal. Now, I want to paint a picture of what happens if you ignore these warning signs. You feel tired, but you dismiss it as aging. Your feet swell, but you blame poor circulation. You can't exercise like you used to, but you assume you're just out of shape. You have a dry cough, but you think it's allergies. You ignore the signals. Months pass. Your heart continues deteriorating. More damage accumulates. Your compensatory mechanisms, the ways your body tries to maintain function despite a failing heart, start to fail. And then suddenly you hit a wall. You can't breathe. Severe shortness of breath. You're gasping. You feel like you're drowning. You can't lie down because you can't breathe when you're horizontal. You call 911. You end up in the emergency room in acute decompensated heart failure. You're admitted to the ICU. You're on oxygen, maybe on a ventilator. You're getting aggressive IV diuretics. You might have heart damage that's irreversible. Your quality of life is shattered. You might be looking at heart transplant candidacy. You might be facing dialysis if your kidneys shut down from the heart failure. You might be looking at a shortened lifespan. But here's the thing. If you'd recognized the warning signs, if you'd mentioned the fatigue to your doctor 6 months ago, if you'd sought evaluation for the swelling, if you'd asked about the cognitive changes, if you'd had an echocardiogram when your exercise tolerance declined, you could have started treatment early. Your heart damage might have been minimized. Your condition would be manageable with medications. You'd still have quality of life. You'd still be living independently. The difference between early diagnosis and late diagnosis is often just recognizing these warning signs and acting on them. So let's talk about what you should do if you're experiencing any of these warning signs. First, call your doctor. Don't wait. Don't dismiss it. Don't think, I'll mention it at my next appointment. If you're experiencing persistent fatigue, shortness of breath, swelling, confusion, decreased exercise tolerance, or a persistent dry cough, call your doctor and describe your symptoms specifically. Second, be detailed about your symptoms. Don't just say, I'm tired. Say, I'm experiencing unusual fatigue that's gotten progressively worse over the past 3 months. I'm sleeping 10 hours and still not feeling rested. Normal activities that I could do easily 6 months ago now exhaust me. Specificity helps your doctor understand the urgency. Third, request appropriate testing. Ask your doctor, could you check my heart function? Request an echocardiogram and blood work, particularly a BNP level. This is a hormone that rises when your heart is under stress. Fourth, if your symptoms are severe shortness of breath, chest pain, severe confusion, don't wait for an appointment. Call 911. Go to the emergency room. These are red flags for acute heart failure crisis. Fifth, once diagnosed with heart failure, take your medications exactly as prescribed. Heart failure medications, ACE inhibitors, beta blockers, diuretics, aldosterone antagonists, they work. They extend your life. They improve your quality of life. Don't skip doses. Don't think you can stop once you feel better. Sixth, monitor your weight daily. Sudden weight gain more than 2 to 3 pounds in a day or 5 pounds in a week indicates fluid retention and worsening heart failure. Report this to your doctor immediately. Seventh, restrict salt and fluid as directed by your cardiologist. Eighth, exercise is tolerated under your doctor's guidance. Moderate exercise actually helps heart failure. Ninth, attend all follow-up appointments and testing. Your doctor needs to monitor your heart function, adjust medications as needed, and catch complications early. Have you experienced any of these warning signs? Do you have a heart failure diagnosis? I want to hear your story. Drop it in the comments. What brought you to seek help? Were these warning signs how you discovered your heart problem? What would you tell someone just now recognizing these symptoms? Ask me your questions. I read every single comment, and I often feature the best stories and questions in future videos. You're part of a community of people taking heart health seriously, learning to recognize danger signs, and taking action before crisis happens. Your experience matters. Your insight might help someone else recognize their warning signs before it's too late. Let's recap the 6 silent warning signs of heart failure. 1. Persistent fatigue that worsens over weeks or months unrelated to activity. 2. Shortness of breath at rest with minimal exertion or waking at night gasping for breath. 3. Swelling in legs, ankles, or abdomen, pitting worsening throughout the day, making shoes and rings tight. 4. Confusion or cognitive changes, memory loss difficulty, concentrating, brain fog. 5. Decreased exercise tolerance, activities you could do easily now exhaust you. 6. Persistent dry cough that doesn't respond to typical treatments. These aren't normal aging. These aren't minor symptoms to ignore or accept. These are your heart screaming for help. These are early warning signs that your heart is failing. And here's what I want you to understand most deeply. Early recognition equals early treatment equals preserved quality of life. Your heart is trying to tell you something. Listen to it. If you experience any of these warning signs, call your doctor. Don't dismiss it. Don't wait. Don't assume it's normal. Your life could depend on recognizing these signals and acting on them. This isn't about fear. This is about empowerment. You have the knowledge now. You know what to look for. You know what these signs mean. And you have the power to seek help before crisis happens. Please, if you recognize any of these signs in yourself or in someone you love, take action today. Don't wait. Your heart is worth protecting. Before we finish, I need to be absolutely clear. If you're experiencing severe chest pain, severe shortness of breath, loss of consciousness, or any of the warning signs combined with severe symptoms, call 911 immediately. Go to the emergency room. Don't wait for a doctor's appointment. This video is for educational purposes only. It is not personal medical advice. Heart failure diagnosis requires professional medical evaluation, testing, and treatment by a qualified cardiologist. Always consult your doctor about health concerns. If you want evidence-based senior health content every single day, information that could literally save your life, subscribe to this channel now and turn on notifications. I'm Dr. William. Thank you for watching. Your heart is worth protecting. Take care of yourself.